The COVID-19 pandemic has had a profound impact on our world. While we have made significant progress, COVID-19 remains a concern in 2025. The virus is still circulating. New variants continue to emerge. It is crucial to stay informed about the evolving situation. We must prioritize our health and well-being. The good news is that we now have the tools to effectively manage COVID-19. Vaccines have been instrumental in reducing severe illness, hospitalizations, and deaths. Staying updated with vaccinations is the best way to protect ourselves and our communities. By staying informed and getting vaccinated, we can navigate this ongoing health challenge. We can minimize the impact of COVID-19 on our lives. Staying updated with COVID-19 vaccinations is more crucial than ever. Vaccination is our strongest defense against the virus. It helps our bodies develop immunity and fight off infection. Vaccines are especially important for vulnerable populations. This includes older adults, individuals with underlying health conditions, and pregnant women. Vaccination can significantly reduce their risk of severe complications from COVID-19. Staying updated with vaccinations also helps to slow down the spread of the virus. When more people are vaccinated, there are fewer opportunities for the virus to transmit from person to person. This is known as herd immunity. By getting vaccinated and staying up to date, we contribute to a safer and healthier environment for everyone. As the virus continues to evolve, so do our vaccines. New vaccines are developed and released each year to target the most prevalent COVID-19 variants. These updated vaccines offer better protection than previous versions. For the 2024 to 2025 season, new vaccines are available that specifically target the KP.3, 1.1, and XE variants. These variants have become increasingly common and pose a significant threat to public health. The updated vaccines are designed to trigger a stronger immune response against these variants. They provide broader protection against severe illness, hospitalization, and death. It is important to note that these are not booster shots. They are updated formulations intended to provide optimal protection against the circulating variants. The Centers for Disease Control and Prevention, CDC, recommends that everyone 6 months of age and older receive the updated 2024 to 2025 COVID-19 vaccine. This includes individuals who have been previously infected with COVID-19. Vaccination is particularly important for certain groups, including older adults, individuals with underlying health conditions such as diabetes, heart disease, or lung disease, pregnant women, and individuals planning pregnancy. Vaccination is safe and effective for these groups. It provides essential protection against the severe effects of COVID-19. Section 5, Vaccination Schedule, a guide for all ages. The CDC has released a recommended vaccination schedule for the 2024 to 2025 COVID-19 vaccines. This schedule is designed to ensure that everyone, regardless of age or health status, receives the appropriate level of protection against the virus. The schedule varies depending on age and previous vaccination history. It is crucial to follow these guidelines to maintain community health and prevent outbreaks. Children aged 6 months to 4 years should receive all recommended doses of the COVID-19 vaccine, including at least 1 dose of the 2024 to 2025 vaccine. This helps build their immunity at an early age. For children aged 5 to 11 years, they should receive 1 dose of the 2024 to 2025 Moderna or Pfizer-BioNTech vaccine. This single dose is sufficient to boost their immune response. Adolescents and adults aged 12 to 64 years should receive 1 dose of the 2024 to 2025 Moderna, Pfizer-BioNTech, or Novavax vaccine. This age group is vital in controlling the spread of the virus due to their high interaction rates. If receiving the Novavax vaccine, 2 doses are required initially. This ensures a robust immune response and long-lasting protection. Older adults aged 65 years and above should receive 2 doses of any 2024 to 2025 COVID-19 vaccine, spaced 2 to 6 months apart. This age group is at higher risk and needs stronger protection. Those receiving the Novavax vaccine require 3 doses, 2 initial doses 3 to 8 weeks apart, followed by a 3rd dose 6 months later. This extended schedule ensures maximum efficacy for older adults. It is important to follow the recommended vaccination schedule to ensure optimal protection. Staying up to date with vaccinations helps protect not just yourself, but also those around you. please consult with your healthcare provider if you have any questions about the vaccination schedule. They can provide personalized advice based on your health history and current condition. Section 6. Special considerations: immunocompromised individuals and recent infections. Individuals with weakened immune systems may require additional doses of the COVID-19 vaccine. This is because their immune systems might not respond as robustly to the standard vaccine series, making them more vulnerable to infections. This is because their bodies may not mount a strong enough immune response after the standard vaccine series. Therefore, extra doses can help boost their immunity to a safer level. If you are immunocompromised, it is essential to consult with your healthcare provider. They can evaluate your specific health needs and determine the best vaccination plan for you. They can assess your individual situation and provide personalized recommendations for vaccination. This tailored approach ensures you receive the most effective protection. If you have recently been infected with COVID-19, the CDC recommends delaying vaccination for 3 months after symptoms first appeared or a positive test result. This waiting period helps your body recover and build up natural immunity. This allows your body time to build up natural immunity. Engaging in healthy activities during this period can also support your recovery. However, the optimal timing for vaccination after infection may vary depending on individual risk factors and local COVID-19 levels. Staying informed about your local health guidelines is crucial. It is always best to consult with your healthcare provider for guidance. They can offer the most accurate advice based on your health status and local conditions. Section 7. Available vaccines, types and safety. Currently, there are 3 types of COVID-19 vaccines authorized for use in the United States: mRNA vaccines, Moderna, Pfizer-BioNTech. These vaccines use messenger RNA, mRNA, to teach our cells how to make a protein that triggers an immune response against the virus. Protein subunit vaccine, Novavax. This vaccine contains a harmless piece of the virus's spike protein, which our bodies recognize as foreign and mount an immune response against. All 3 types of vaccines are safe and effective. They have undergone rigorous testing and have been shown to significantly reduce the risk of severe COVID-19. Serious side effects from COVID-19 vaccines are extremely rare. The benefits of vaccination far outweigh the risks. Section 8. Combining vaccines: flu, RSV, and COVID-19. It is safe to receive the COVID-19 vaccine at the same time as other vaccines, including the flu vaccine. In fact, getting both vaccines together can provide comprehensive protection against these respiratory illnesses. The optimal time to get the flu vaccine is in September or October, before flu season begins. However, you can get the flu vaccine anytime during flu season. Data on combining the COVID-19 vaccine with the respiratory syncytial virus, RSV vaccine, is still emerging. However, the CDC recommends the RSV vaccine for older adults and pregnant women, as RSV can cause serious illness in these groups. Section 9. The global fight against COVID-19, monitoring variants and vaccination efforts. The fight against COVID-19 is a global effort, involving countries from every corner of the world. This pandemic has shown us that viruses know no borders, and our response must be equally global. Scientists and health organizations worldwide are continuously monitoring the emergence of new variants. Their work is crucial in understanding how the virus evolves and spreads. They are tracking the spread of the virus and working to ensure equitable access to vaccines. This means making sure that vaccines reach even the most remote and underserved communities. As of November 2024, the World Health Organization, WHO, reported that the JN.1 variant, while still a variant of interest, VOI, had decreased in prevalence. This is a positive sign, but the fight is far from over. Meanwhile, the KP 3.1.1 and XEC variants were on the rise. These new variants pose new challenges and require continuous vigilance. 7 other variants were under monitoring. Each variant has unique characteristics that can affect transmissibility and vaccine effectiveness. The global COVID-19 situation remains dynamic. It is essential to stay updated with the latest information and adapt our strategies accordingly. While test positivity and new cases have increased, new deaths, hospitalizations, and ICU admissions have decreased. This indicates that while the virus is still spreading, its impact is being mitigated. Vaccination remains crucial in our global fight against COVID-19. It is our best tool to prevent severe illness and death. It is the most effective way to protect ourselves, our loved ones, and our communities. Vaccines help us return to a sense of normalcy and reconnect with those we care about. By staying informed, getting vaccinated, and following public health recommendations, we can contribute to a healthier and safer future for everyone. Together, we can overcome this pandemic and build a more resilient world.